Dealing with an old patient is sometimes quite cumbersome. There are a lot of disorders that are related to the psychiatric or the mental illnesses in the old age group of the individuals. So what are the risk factors that can make the person more prone to the development of these old age psychiatric illnesses? Obviously, the environmental factors, they play a very pivotal role in the development of these psychiatric illnesses. Ranging from the depression, ranging from the anxiety disorders, as well as the affective disorders known as the mood disorders. And then we have even the very late onset schizophrenias that are quite commonly seen in the old age group. So dealing with these multiple problems can be quite cumbersome for the practicing psychiatrist, differentiating these psychiatric illnesses from deliriums or dementias that have their organic causes. And then also getting the preliminary investigations done is also quite a practice that has to be followed by the clinical psychiatrist who's dealing with the geriatric psychiatry. So geriatric psychiatry is basically the field of psychiatry which is focusing on the problems of the old age group people. And this is again very pivotal to basically know this age group and know the problems of this age group because of the life expectancy that has changed along with the passage of time due to the development of the health facilities. So we'll be discussing all of these psychiatric disorders that are related to the old age psychiatry over here in this section. Primarily, we'll be discussing the prevalences of these disorders. So, as I've already emphasized on the fact that due to the health facilities that have changed with the passage of time, this old age group, which is basically defined as men and women that are more than 65 years of age, they are basically gathered together in this age group, which is known as the geriatric psychiatry. So the prevalences again will be discussed over here, and then I'll just go on and discuss the epidemiology relating to such psychiatric mental disorders over here. Then there are specific stressors that are quite common to this old age group. A lot of stressors, obviously, as we've already discussed in the child psychiatry, there are a lot of stressors of the adolescent age group, and then there are the life stressors of the old age group. So we'll be discussing these life stressors that can basically make this person more prone to the development of the psychiatric disorders over here. So first of all, introducing these geriatric medicines, again, very important. We are dealing with people over 65 years of age. The population of 65 million is more or less 10 to 11 million people over 65 years of age. So this is the population, or this is the age group that we are discussing over here. About 14 to 15% people of over 65, they reach, that is almost more than 90 people, they reach this age group. If we are basically considering a population of 100 people, more than 90 people will reach this age group of more than 65. So this is basically very important to discuss these age group and what are the problems that are relating to this age group. It's again very important. Nearly 14,000 people over 100 years of age, a rise of 70% over the past decade. So this is the life expectancy that has already increased with the passage of time. And that is basically the issue that we are discussing, that people are reaching this age group more frequently now. So we should know how to deal with the problems of such people as well. As this chart is also mentioning over here, we have the single morbidities that are compared with the multiple morbidities over here in males versus the females. So the females are more prone to developing these comorbidities as well over here. Overall life expectancy has risen 79 years for men and 83 years for women. So this is the life expectancy that has changed over the passage of time. Psychiatric disorders in older people, they can range from the organic disorders that basically deal with the late life function disorders, and that basically includes the mood disorders, which are also known as the affective disorders. People can be diagnosed as suffering from the bipolar affective disorders as well, or even sometimes the unipolar affective disorders over here. The neurotic stress-related disorders or the somatoform disorders are again quite common. The causes over here are again organic. It can be the causes related to the heart, the respiratory system can be involved, the central nervous system is involved in a lot of cases. That is basically presenting in ranges from delirium and dementia as well. So the schizophrenia or the schizotypal disorders are quite common, and they are also known as the functional psychosis over here. Then we have the psychoactive substance use disorders, in which basically the person goes about and he's misusing some sort of a drug, for example, alcohol. Suicidal behaviors are also quite common in elderly because depression is quite common in elderly, and due to this severe depression, these suicidal thoughts, they come to the mind of the person, and so these suicidal attempts are quite common in this geriatric psychiatry that we are discussing today. Second most common cause of disability among the people aged 65 and older other than arthritis. So after arthritis is the leading cause over here, and then we have these psychiatric disorders in these people who are basically over 65 years of age group. The late life stresses that we were already focusing on and that basically make the person more prone to the development of the psychiatric illnesses are the chronic physical health conditions, the death of a loved one, and then it can be any caregiving phenomena. If there is a lack of the caregiving or any primary caregiver is not present in the life of the old age person, then he may go into depression or he may get to develop those suicidal thoughts. Social isolation is another phenomena that is quite commonly seen in these old age group people. Then we have the significant loss of the independence. So basically due to any physical disabilities or any comorbidities that a person is suffering from, the person or the old man or woman is basically dependent on their primary caregivers, and that make them basically the life more stressful for such individuals. Then we have the history of mental illness. So if a person is basically suffering from any sort of mental illness previously, he is more prone to the development of psychiatric illnesses that are common in the old age group. The points of discussion that we'll be discussing along are what is geriatric psychiatry, the demography of the aging, the geriatric statistics, and the epidemiology of the psychiatric disorders worldwide will also be discussed over here. And then the common psychiatric disorders in the old age. So basically, we have already done with the geriatric psychiatry or the phenomena of geriatric psychiatry, which is basically the psychiatric conditions which are more prevalent in the age group of more than 65 years. It's basically known as geriatric psychiatry. It's a very common disorder, and due to the increase in the life expectancy, one should know how to deal with these geriatric psychiatric disorders. Then the common psychiatric disorders will also be dealt in the subsequent sections of this lecture as well. So the old age psychiatry, if we look at the prevalences over here, the dementia is almost 5.6%, and dementia is 5.7%, neurosis, and then we have manic depression at 1.4%, schizophrenia 1.1%, and any other disorders are almost 26.3%. So these are the prevalences of these disorders in this old age psychiatry that we're discussing today. So basically over here we gave an introduction towards the geriatric psychiatry and what are the common illnesses that are prevalent in this age group. So that is the end of this section. Thank you for watching sqadia.com.